you have that silent heart attack. You don't feel any symptoms. In that case, what is going on?
About 20% of patients can exhibit a silent heart attack, which means either they did not have symptoms at all, or they had, once we start questioning them, once we see that they've had a heart attack in their EKG and they come to our offices or to our hospital, they tell us, oh, doctor, 4 years ago I had this really bad night of heartburn and chest sensation. I took some Tums, it went away, and maybe that was their heart attack. Yes, we do see patients with silent heart attacks. Unfortunately, we also see patients with the ultimate type of bad heart attack, which is sudden death.
So I wanted to ask you, sometimes we see these in movies, or you see a commercial and that person kind of clenches their heart, they just kind of fall over and that's it. There's none of the symptoms that we had discussed earlier. And that's what you refer to as a sudden heart attack?
As a sudden death is sudden death. And when someone has a heart attack or a blocked artery, like we showed in the diagram,
right,
a lot of things can happen. The best thing that can happen is that you have symptoms of chest pain, chest pressure, you take an aspirin, you call 911, you come to the hospital, and we open your artery up in less than 60 minutes, which is our American College of Cardiology mandated goal.
Right.
If that does not occur, there's two things that can kill you from a heart attack. One is that the damage is so extensive that you get pump failure. I mean, there's so much muscle that is damaged and it's not pumping that you go into heart failure and eventually cardiac arrest. But the other most common reason that people die of a heart attack is arrhythmias. When there is an occluded artery, and it could be a small artery or a big artery, right, you can go into ventricular fibrillation, which essentially is the heart stops beating and just fibrillates, and that's equal to death. And that's when you see those people that you say that fall over, that you see in the movies.
Yes.
Well, they could be falling over just because they're dizzy and their blood pressure drops. But if they develop one of these lethal arrhythmias, if there is not a defibrillator close or CPR to be administered, that is sudden death, essentially.